The Achilles tendon is the strongest tendon in the body. It's the tendon in your heel that allows your foot to go down as you're walking. Injuries to the Achilles tendon are extremely common. We see patients who develop tendinitis of their Achilles tendon, as well as patients who rupture their Achilles tendon. Achilles tendon tears generally affect patients between the ages of 30 and 60 years of age, oftentimes when they're participating in athletic activities.
Achilles tendon tears typically occur from what we call an eccentric load, meaning that the muscle is contracting but lengthening at the same time, and that can cause the tendon to rupture. Now, typically when that happens, there's been some sort of underlying problem with the tendon that the patient may be completely unaware of. Some people do have pain in their Achilles tendon with activity, etc., before they have an Achilles tendon tear, but the vast majority of people really don't know that there's anything wrong with their tendon. And sometimes a totally normal tendon ruptures, but usually there's some evidence of some tendinosis or tendinopathy prior to the rupture.
Once the Achilles ruptures, it can be treated conservatively or surgically. The downside to the conservative treatment is that, number one, it takes a long time to get back to regular activity, on the order of 9 to 12 months. The other downside is that when the Achilles tendon ruptures, it does so because there's a lack of blood supply to the region of the tear. So once you reach a critical mass of damaged tissue, just that little bit more stress will cause a rupture. So once that thing tries to heal, you're healing with scar tissue. You're not healing with healthy tendinous tissue. So there's always a little bit of an increased risk of re-rupture. To treat it surgically is a benefit for a couple of reasons. One is it gets you on your feet and moving faster, so the other things, your knee, your ankle, your hips, don't suffer by the inactivity. And the other is that by repairing the tendon and augmenting that repair with healthy tissue, like a tendon transfer, kind of takes that pathologic or unhealthy tissue out of the picture and significantly decreases the risk of re-rupture. So between the decreased risk of re-rupture and the ability to get back on your feet a lot sooner, like on the order of 6 months sooner, there's some benefit to a surgical repair in somebody who's an otherwise active individual and likes enjoying athletic activities.